Hey, thanks so much for joining us here on 9 News Plus. I'm Chris Bianchi, joined by our 9 News medical expert, Dr. Payal Kohli, for a look specifically at vaccinations for children under 5. So you mentioned that the data is showing that it's highly effective. Could you get into more details about the data?
Yeah, so let's talk about it. Two different vaccines, Moderna and Pfizer, and they're designed a little bit differently here. So the Moderna vaccine is 25 micrograms, which is a quarter of the adult dose, given 3 weeks apart. And it actually doesn't have as good efficacy as the other one. So with that regimen, in the older kids, the ones 2 to 5, you have about a 37% protection. And in the younger kids, 6 months to 2 years, you have about a 50% protection. So pretty good, but kind of like the flu shot, not great. Not what we were saying with the original vaccines, especially in the adults. But we do see that that immune response is boosted. So the reason we feel like the protection is not as good, because they looked at Omicron. And the vaccine's really designed against the original variant. We know Omicron evades our immune system better, but still pretty good efficacy. 1 out of 3 protection in younger kids, 1 out of 2 protection in older. The Pfizer one is different. That's a 3 microgram dose, so it's a 10th of the adult dose. Wow. You get it at day 0, then you get it again 3 weeks later, and then you actually get another shot 8 weeks later. So it's a 3-dose regimen for our kids because they found out that 2 wasn't enough. In fact, 2 really wasn't protecting and causing an antibody response. So parents really have to be aware that that 3rd dose is not a booster dose, but it's actually part of the full vaccination series. And with those 3 doses, you have pretty good protection, about 80%, plus or minus 2-3% for kids across the board.
So 3 doses.
For Pfizer.
For Pfizer. Mm-hmm. With that in mind, based on the data, are there, you mentioned it seems safe, but are there any known risks or concerns at this point?
Yeah, so about 1 out of 4 kids had a fever. So
Okay.
Kids can have a little more fever than adults sometimes. The muscle aches and pains, the fatigue, the arm reactions, soreness at the site. But really, thankfully, with neither vaccine, any signs of pericarditis or myocarditis, especially that heart inflammation that we worried so much about in our young adolescent boys, we are not seeing that in this younger age group. Now, the small little grain of salt with everything is that thankfully there were few cases, but there were very few cases of COVID and altogether. So when you start doing something on a population level, that's when the really rare signals can start to amplify. But based on what we've seen so far, I feel comfortable saying that, it's a safe vaccine and that it's effective as well.
I'm going to ask you, admittedly, a tricky question here, but I think it's one that a lot of parents may want to ask about this is, I think at this point, and correct me if I'm wrong, know that COVID tends to affect kids less than adults. With that in mind, and again, admittedly a tricky question, I'm asking this on behalf of parents that may have this question, why vaccinate if, again, COVID may affect kids less?
Great question. I think it's on every parent's mind. I have no doubt in my mind if I had a child and for my nephew, I'm going to get them vaccinated. And there's many reasons for that. Number one, it's almost like a deposit into their immune system savings bank. So every time you give them a vaccine, you actually boost their immunity against other respiratory infections too, but it also helps kind of flex their immune system's muscle. So that's number one. Number two, there may be evidence, and we don't yet know this, but it's starting to emerge, that by vaccinating and preventing infection, they're less likely to develop any kind of complications of the virus or long COVID, which we know is affecting kids as well. So that's the other reason. You're investing in their immune system savings bank, you're preventing acute complications, keeping them out of school, disruption to your life, long COVID, those types of things. And then you're actually helping in our entire fight against COVID, because we know that even though kids may not get as sick, they definitely transmit the infection. And it's important, if we keep transmitting the infection and this big portion of the population doesn't get vaccinated, that infection is going to keep spreading, and that next variant may actually evade the vaccines.
Okay, so those are a couple of really
good reasons. Did
right
I convince
there.
you?
And yeah, you certainly could. I mean, again, I think a lot of questions maybe coming from parents on that. And again, to kind of reiterate, there are also, at this point, none of the myocarditis concerns that we had with some of the young adolescent boys, right?
We are not seeing that signal at all. Now, we'll do very close monitoring, of course, as it launches, but your risk of getting myocarditis, Chris, from the virus is actually much higher than your risk of getting it from the vaccine. So if you're in Vegas or you're playing the statistical odds, it is much better to actually take the vaccine, protect your child against the infection, than it is to roll the dice on that. And we also know that the vaccine, even if it doesn't protect against symptomatic infection, because they may be saying, 30%, 50%, that's not that good, it'll make the infection less severe. It'll make your child less likely to end up in the hospital, and it also make them less likely to have those complications of long COVID.
Do we know, does this give less of a chance of a child between the ages of 6 months and 5 years old? Does it reduce their chances of getting the virus overall?
Yes, that's
does,
the
okay.
efficacy numbers I talked about. So if you get Pfizer, there's an 80% reduction in symptomatic
Okay.
infection. And if you get Moderna, it's somewhere between 37 to 50, depending on the age of the child.
I'm still figuring out some of these terms still.
I know,
We're
I'm throwing a
2+
lot
years
of
into
numbers
this.
at you.
No,
Yeah.
I'm
Yeah.
still figuring it out. Any final thoughts? Anything else that you think sticks out about this?
You know, I think one thing we've learned in the last couple of years, especially when it comes to infectious disease, the best way we can protect ourselves is to get our immune system in best shape. And that means giving it all the tools that it can. Vaccinations save lives. Vaccinations eradicate disease. And I think this epidemic has taught us that being vaccinated has allowed us to get our lives back to normal for many of us. Whereas we were in a whole different position 2 years ago before the vaccine. So I think we should celebrate the science, we should embrace it, and we should use it to help our children be healthy and help our lives get back to normal.
Well, we celebrate you, Dr. Payal Kohli, our 9 News medical expert. Thanks so much for a detailed look here at under 5-year-old children's vaccinations, which again seem right around the corner. We appreciate the immense your time here, Dr. Kohli.
Thank you.